Hi everybody, thank you so much for clicking once again. You're on to Medicine on Air with Dr. Bertha. Today, September 21st, 2025, is the World Alzheimer's Day. It's a day to create awareness concerning Alzheimer's dementia. And the theme for the year is Ask About Dementia, Ask About Alzheimer's. For that reason, I'm starting a series on dementia, a topic, a condition very close to my heart. What is dementia? Dementia is taken from two Latin words, de and mentis, which means without the mind. It is a condition that affects the cognitive functions of the brain. The cognitive functions are those aspects of the brain that help you to understand and interact with the world. It includes memory, remembering conversations, remembering things, remembering where you kept your money or what you used it for. It includes language, remembering what to say, knowing the correct name of an object, recognizing objects, recognizing personal items, recognizing familiar persons like members of your family, friends, neighbors, colleagues. It includes problem solving, planning, execution. It also includes behavior. It includes orientation, knowing where you are and where you're going to. And so once there's a derangement and impairment of these functions, it causes a lot of problem socially, occupationally, family interactions, and otherwise. The World Health Organization says 57 million persons suffer from dementia worldwide. Regrettably, more than 60% of them live in low and middle income countries like ours. Dementia is the 7th leading cause of death worldwide. What are the causes of dementia? Commonest cause worldwide is Alzheimer's dementia. Others include vascular dementia. That is a type of dementia that occurs after a stroke. At times, the stroke may not even be obvious, minor negligible strokes, and after having several, they coalesce and the person starts having problem remembering whom he or she is, looking for personal items, having problems with speaking, having problems with knowing where he is or she is, and finding his or her way around. Other common causes include head trauma, after having any accidents, any type of trauma affecting the brain. Others are chronic infections like HIV/AIDS, chronic alcoholism, substance use and abuse, including drug abuse, brain tumors, and even vitamin deficiencies. Who is at risk of having dementia? It's a disease of the senior citizens, persons who are more than 65 years, and the older the person gets, the higher the risk of dementia. Younger persons can also have dementia, and common risk factors include hypertension, diabetes mellitus, chronic alcoholism, heart disease, poor education, physical inactivity, mental inactivity, social isolation, and poor interaction. These are some of the common risk factors for dementia. The person with dementia is one of us. Your father, my father. Your mother, my mother. Your mother-in-law, father-in-law, uncle, auntie, elder sister, elder brother. The problem with dementia is because back home in sub-Saharan Africa is poorly understood. There is so much misunderstanding, so it leads to elder abuse. It leads to family disharmony, marital disharmony, a lot of stress financially, caregiver burden. It causes a lot of problems. Some are committed into mental health institutions. Some are taken to the church. Some are abandoned because people don't understand what is happening. And so in the next video, I'm going to take time to explain the symptoms so that you can understand and recognize them. Please like this video, share it so that others may also know. Thank you so much for listening.